Millions of people take metoprolol every single day, and most of them have no idea what it's quietly doing to their body beyond lowering their heart rate. Metoprolol is one of the most prescribed heart medications in the country. Doctors use it for high blood pressure, heart failure, atrial fibrillation, and chest pain. It works. It saves lives. But it also comes with a list of side effects that almost nobody gets a full explanation about. Not in a 10-minute office visit, and not on the pharmacy printout most people fold up and never read. Some of these side effects are well known. Some get written off as aging, stress, or something else entirely. And a few of them are genuinely surprising, even to patients who've been on this medication for years. So let's go through all 8. What they are, why they happen, and what you can actually do about them. Starting with the one that catches people most off guard. Fatigue. And not just regular tiredness, a kind of heavy whole-body fatigue that some patients describe as feeling like they're moving through water. They sleep 8 hours and still wake up exhausted. They sit down to watch TV and feel drowsy within minutes. They wonder if something is wrong with them. What's happening is actually straightforward. Metoprolol is a beta blocker. It works by blocking the effects of adrenaline on your heart. That slows your heart rate and reduces how forcefully it beats. That's the goal. But when your heart is beating more slowly and with less force, less blood is being pumped out to your muscles and your brain with every cycle. Your tissues are getting slightly less oxygen and energy than they're used to. The result is that dragging, low-energy feeling that can persist for weeks or even months after starting the medication. For most people, the fatigue improves over time as the body adjusts, but if it's severe or it's not getting better, that's worth bringing up with your doctor. There are other beta blockers and other medication classes that might work better for you individually. The second side effect is one that causes a lot of quiet embarrassment and almost never gets discussed. Sexual dysfunction. In men, metoprolol can cause difficulty getting or maintaining an erection. In women, it can reduce sensation and make intimacy far less satisfying than it used to be. Both men and women sometimes notice a drop in their drive and interest altogether. This isn't a coincidence. Beta blockers reduce blood flow throughout the body, including to the genitals. They also lower the release of hormones involved in arousal. The combination affects both the physical and emotional side of a person's intimate life. Many patients stop the medication on their own because of this, which is dangerous. Others just suffer in silence because they don't connect it to the drug. If this is happening to you, talk to your prescribing doctor. This is a recognized, documented side effect. It's not in your head. And there are options. Side effect number 3. Cold hands and feet. Your fingers feel like ice even when the room is warm. Your feet go numb on a cool evening. You find yourself wearing socks to bed in the summer. Again, this comes back to what beta blockers do. By slowing the heart and reducing its output, they cause blood vessels near the surface of your skin, especially in your hands and feet, to constrict. The body is prioritizing blood flow to your vital organs. The extremities get less circulation as a result. For most people, this is an annoyance. For some, it can be genuinely uncomfortable. Keeping your extremities warm, avoiding prolonged cold exposure, and staying physically active can help. But if you notice your fingers or toes turning white or blue, or if you have a history of Raynaud's disease, tell your doctor immediately. Metoprolol can make that condition significantly worse. Number 4 is one that surprises a lot of people because it seems completely unrelated to a heart medication. Sleep disturbances and vivid dreams. Patients on metoprolol often report strange, unusually vivid dreams. Some describe nightmares. Others say they wake up multiple times a night and can't get back to sleep easily. Some notice their sleep just feels less restful, even when they're technically getting enough hours. Metoprolol crosses something called the blood-brain barrier, which many other beta blockers don't do as easily. Once it gets into the brain, it can interfere with normal sleep architecture, the natural cycles your brain moves through during the night. It affects melatonin production and alters the balance of neurotransmitters involved in sleep regulation. Taking metoprolol in the morning instead of at night can reduce this effect for some people. If sleep problems are significant, your doctor may consider switching you to a beta blocker that doesn't cross the blood-brain barrier as readily. Side effect 5. Depression and mood changes. This one is underreported, and the research on it is more nuanced than a simple yes or no answer. What we do know is that some people on beta blockers, metoprolol included, experience a low, flat mood. less motivation, less interest in things they used to enjoy. A kind of emotional blunting. It's not depression in every case, but in people who already have a tendency toward depression or anxiety, metoprolol can make that worse. The mechanism ties back to the drug's effect on the brain. It reduces adrenaline activity, which also means it can reduce the sense of energy, alertness, and emotional engagement that adrenaline normally contributes to. If you've noticed a shift in your mood since starting metoprolol, don't dismiss it. Bring it up. It matters. Number 6 is one that many patients never connect to their medication at all. Dizziness and lightheadedness, especially when standing up quickly. This happens because metoprolol lowers blood pressure. When you stand up suddenly, gravity pulls blood down into your legs. Normally, your heart and blood vessels compensate almost instantly. But with metoprolol on board, that response is blunted. Blood pressure drops briefly when you stand, and before your body catches up, you feel dizzy or even like you might faint. The medical term is orthostatic hypotension, and it's particularly common in older adults on metoprolol. The fix is simple but important. Stand up slowly. Sit at the edge of the bed for a few seconds before standing. Give your body time to adjust. Stay well hydrated. Avoid hot showers or baths, which dilate blood vessels and can make this worse. If you've been feeling lightheaded regularly, especially first thing in the morning or after standing, mention it at your next appointment. Side effect 7 involves something you might not expect from a blood pressure medication: weight gain. Not dramatic weight gain in most cases, but a slow, gradual increase of a few pounds that doesn't seem connected to any change in eating habits. Metoprolol slows the heart rate, which means it also slows your metabolic rate slightly. Your body is burning fewer calories at rest than it was before. On top of that, the fatigue that comes with the medication means many people move less and exercise less, which compounds the effect. Beta blockers can also affect how your body processes blood sugar and fat. They blunt the release of adrenaline, which normally triggers fat breakdown during physical activity. So even when you do exercise, the calorie burning efficiency may be somewhat reduced. This doesn't mean you'll gain a lot of weight, but it does mean that staying active and being mindful of what you eat becomes even more important while you're on this medication. The weight gain is real. It's not just a lack of willpower. And the 8th side effect, one that's serious enough to require its own clear explanation: bradycardia, an abnormally slow heart rate. Metoprolol is designed to slow the heart. That's the mechanism. But in some people, it slows it too much. A resting heart rate below 50 beats per minute, especially one that causes symptoms, is something that needs medical attention. Signs that your heart rate may be too slow include unusual fatigue, shortness of breath with minimal activity, feeling faint or nearly faint, confusion, or a general sense that something is off. Some people don't feel anything at all, which is why regular monitoring matters. If you're on metoprolol, it's worth knowing your resting heart rate. A simple check with a smartwatch, a blood pressure cuff with a heart rate monitor, or just counting your pulse for 60 seconds gives you useful information. If it's consistently below 50 and you feel unwell, don't wait. Call your doctor. One thing that's critical to understand: never stop metoprolol abruptly. Stopping it suddenly, without tapering, can cause a dangerous rebound effect. Your heart, which has been protected from adrenaline, suddenly gets flooded with it. That can trigger rapid heart rate, chest pain, or even a heart attack in people with heart disease. If you want to stop or change this medication, work with your doctor to do it gradually and safely. So where does that leave you? Metoprolol is a valuable medication for millions of people. It lowers blood pressure, reduces the risk of heart attacks, manages heart rhythm problems, and helps people with heart failure live longer. The goal here isn't to scare you away from it. The goal is to make sure you know what you're looking for: fatigue, sexual dysfunction, cold extremities, sleep disturbances, mood changes, dizziness when standing, gradual weight gain, and a heart rate that drops too low. These are all recognized side effects. They're real. And in most cases, there's something that can be done about them, whether that's adjusting your dose, changing the timing of when you take it, addressing the symptom directly, or switching to a different medication altogether. The best thing you can do is stay aware of how you feel, track any changes that started around the time you began metoprolol, and bring specific observations to your doctor. Not vague complaints, specific ones. My heart rate has been around 48 in the mornings. I've been waking up 2 or 3 times a night since starting this. I've gained 6 pounds and nothing in my diet has changed. That kind of specific, clear communication is what leads to real solutions. You deserve to feel well on your medication, not just protected by it. And there you have it. Take this knowledge and take control of your health. Thank you for watching.